Hi, in this video we'd like to talk about another common form of miscarriage, which is recurrent miscarriage in the form of immunological factors. So how can you know that you have an immunological factor? Because it is incredibly common, being one of the most common causes for recurrent miscarriage. How can you self-identify if you have this factor within you affecting your pregnancy, and how can you seek the proper treatment? Now, immunological factor arises from a history of induced abortions or C-section delivery or natural birth as well. As long as there is a potential chance of any fetal tissue, any tissue from the pregnancy that has genes that are not of the mothers alone. So usually these types of genes have paternal genes and maternal genes as well. And if there's any risk of these types of tissue entering into the mother's body, it can easily hypersensitize the mother because of the immune reaction generating these antibodies. The presence of these antibodies alone is already known as the immunological factor. So if you'd like to self-identify, first of all, ask yourself, do you have a history of any C-section delivery or natural birth, or the most common cause, an induced abortions, especially if you have multiple induced abortions. This is more puts you in a high risk category of developing this immunological factor. And furthermore, have you been experiencing unexplainable miscarriages? You're unable to get full-term pregnancy, but you're not struggling with infertility. You're still able to get pregnant, but you realize that during week 6 to week 12, somehow this pregnancy terminates itself in the form of either there's no fetal heartbeat, there's no fetal activity, or there's some form of disturbance that is causing this pregnancy loss to happen over and over again. And if you notice that it's happening in the same pregnancy week, roughly, let's say you've miscarried 3 times consecutively. So the first miscarriage happens on the 7th week, the second one happens on the 8th week, the third one happens on the 7th week as well, 7th week as well. Then we can say that this is clearly there is a trend, and if there's no doctor that can identify what is causing it, and you also know that you have a history of induced abortions, you can easily self-identify that it could very well be this immunological factor playing a role. At Antai Hospital, we offer you a highly effective gene vaccine that can neutralize the antibody, and it's very effective, up to 95% success rate. That is why we offer a full refund guarantee that ensures you have a successful next pregnancy. And the administration as well is very easy and straightforward. We only administer it via injections, intramuscular injections. There's no surgery required. All we need to do is do a simple blood test, identify the levels of the antibody present. The more miscarriages you have, generally there will be a higher level of these antibodies. And another form of this type of miscarriage is a chemical pregnancy as well, which is also in this same bracket. We will do the same diagnosis and treatment, which is to get a blood test and assess what are the levels, and then issue you the relevant dosage that you need to neutralize this antibody. And within a 6-month period after treatment with us, you need to get pregnant within this 6 months. Conceiving must occur within this 6 months, otherwise the treatment won't be that effective. So you'll need to get another dose of this anti-immunotherapy if you do not get pregnant within the 6 months. If you do, then rest assured your pregnancy will be a full-term successful one. So do ask yourself these questions. Have I been having recurrent miscarriages happening roughly around the same week, and no doctors is able to help me and give me the effective treatment? No doctor can guarantee me successful pregnancy. Second of all, do you have a history of multiple induced abortions, C-sections, or natural birth delivery? Anything that can allow fetal tissue to enter into your bloodstream. These 2 important questions, if you can answer them, then we can figure out that there is an immunological factor at play. So do get in touch with us if you'd like to find out more information, set up a consultation, or if you'd like to receive this treatment with us, do visit the link via our website. We are looking forward to talking to you.